Good day everyone, I'm with Mark Heywood from Section 27 and also TAC. Mark, can you please maybe tell me a brief history about yourself and what you do also?
My name is Mark Heywood. I'm the director of Section 27, which is an organization based in Johannesburg that campaigns and carries out legal work for the right to health in South Africa. So we work with many people on many different issues that are to do with health. I'm also one of the founders of the Treatment Action Campaign. I've done a lot of work on the rights of people with HIV to have access to antiretroviral treatment. So I guess I would describe myself as a campaigner for social justice, and in particular a campaigner for the right to health.
Okay. And second question, Mark, what message are you taking from this National Assembly in moving forward also?
Well, the message that I'm taking is that we had people here from 9 different provinces, all of our provinces in South Africa. We had people here who are people who work in the health system. We also had people who are users of the health system. We had young people, we had older people, we had black people, we had white people. We showed quite a lot of unity and understanding across all the people here about how important health is. And health is central to people's lives. You know, if you don't have health, it's hard to work, it's hard to have dignity, it's hard to be a productive member of society. So we want everybody to understand that health equals power. And so we have to fight for the right to health. It means fighting for our own power for a better society. So it was a very positive meeting. People are united. But of course, the challenge is that's not what we say in a meeting room like this. The challenge is what we do when we go home in our communities. So I hope that people here have felt some power, that they feel inspired, and that they will go back and build change in the communities where they came from.
Mark, as you've covered the question I was going to ask, I'm going to ask how important it is each and every province must engage with the National Treasury so that we can build more projects can be funded in health. How important is that?
Well, one of the big problems in health is that there's not enough money. You know, the government says there's not enough money for doctors, there's not enough money for nurses, there's not enough money for community healthcare workers. We say that if you don't spend that money, you end up spending more money because people get sick, and people who get sick come to hospitals with TB, they come to hospitals with all sorts of conditions. You know, it's better to prevent those conditions, and that means paying for health education, paying for community healthcare workers. So, you know, we think that government is not thinking clearly when it says there's not enough money. There's a lot of money, in fact. And so we need to engage with government, we need to engage with the Treasury and say, okay, show us what money there is, then we will show you how that money can be used effectively for the health system.
Okay, thank you, Mark. That was all from me. Thank you very much, Mark.
Great, it's nice to speak to you, and good luck.
Thank you.
Okay, thank you very much.
Okay.
Thanks, Lebakan. Okay, great.